going to be able to see them in our clinics and didn't know that we were offering telehealth as an option. We had switched our workflow that during, before lunch, we are doing well visits. So our workflow is before lunch, well visits for primary care and behavioral health. People can actually come in with face coverings, be screened before they come to any of our health centers, and do actually a face-to-face visit with behavioral health or a primary care, or get telehealth anytime. And then in the afternoon, where we have patients that need medical care for anything, because people are still sick, and not just with COVID. They could have a sore throat, they could have pink eye, they could have whatever, and still need to see their doctor. Can also see their therapist. So we saw a little drop off, and really right now they really need to see the therapist more than ever, and they do need to engage in services. So we really wanted to reach back out to them when we started seeing a lot of cancellations, and ask them why they canceled, and because they didn't want to come into the clinic, or they didn't know that we had changed our workflow, and nor did they know that we actually had telehealth. And once we started offering that, we started seeing them come back in for services.
I think some of the stuff that we have, people are asking, our staff being safe. They want to know that we're being safe. They want to know why they can't leave the house. We've found that we've had to do a lot of education for our clients and explain what the stay-at-home order means, and why they need to wear masks when they go out. So we found that we've had to do a lot of just really overall communication and reassurance about what's going on and what people need to do to keep themselves and others safe.
I agree with you, Kara. We're doing a lot of that too, of what Robin and Kara just stated. Oxford houses are recovery homes, so our process is where you have to interview and be accepted. So normally we're dealing with treatment centers or people who are ready to get their life back on track. So it's been sort of tough, and we've had to do some different things as far as the process of interviewing, but we are open for business. Most of the houses in Montgomery County are full, so actually we need more houses in Montgomery County. But some of the things that we're doing that's unique to this is that we are interviewing over the phone. We're also doing Zoom interviews to get people in who are in need of help.
Yeah, I mean, I would say that a lot of our patients really, believe it or not, want an excuse to leave the home, and they are craving the social contact, and that might be with their primary care provider, their service provider, or their mental health provider. So even though it may be with masks and gloves, they want to find a reason to do that. And with some of our patients that, especially behavioral health, that have social anxiety, and that might be one of their goals to actually leave the home, it's really important for them to get out. Now, we and I agree with my colleagues, there's a lot of education involved. We are screening them at the door before they actually even come into the health clinic, with all the screening questions that everybody's been educated in the community, their temperatures being taken, or us too. So we, all of our staff, we wear masks, we have our temperatures taken every day. So we're sanitizing our offices like crazy. We actually have an isolation room too, in case anybody kind of slips through the cracks. So they do. And we also are educating our community that we are not a testing site, because they think we are.
Yeah, we have, we've been, had the privilege, our CEO, who is Paul Malloy, has done videos to make sure that our members are aware of what to do. So we've been able to put out videos to each of the houses to let them know what's happening, and keep up to date with a lot of virtual things are happening in our realm today. So we talked about it earlier today, how Zoom has just become sort of major. It's major for us because we still want people to keep their recovery first who are in our houses. So we have, we're doing a lot of virtual Zoom meetings for recovery meetings. We're required to do house meetings and chapter meetings still. So we still want life to go on and people to feel comfortable about their recovery. So we're trying to make it as natural as possible, but it is hard just having to stay in the house a lot.
Yeah, I think that's true. I think really working with people, if you are going to go out, how can you do it safely? Because I agree, people do get stir crazy. We definitely have clients in our residential program who are struggling and want to leave and need to leave and just walk around. So just making sure people are doing it safely and offering them the support. I think doing things, being able to do telehealth, even in our residential program, has been a huge help. Being able to, and use just phone too. I know we'll be talking about telehealth and the barriers. So having those options has definitely been a great help during the pandemic.
Yeah, I agree with my colleagues. I mean, we still have people that really want to still establish care, primary care and behavioral health. New patients, people still need to get their general medical care taken care of. So we actually are enrolling new patients in addition to trying to meet the needs of our current patients. So that's really important that, we've had to explain to our community and our staff that we are open to establish care for people that want to choose CCI for their general health and wellness.
Another thing, we've also touching on the point of essential workers, where people in our houses have to leave out. So we're trying to get creative because it's so hard to get the PPEs. Where people are donating to us to masks and things of that nature, and just emphasizing everything that the CDC is saying that we need to do. So we're constantly communicating on that point because that's so important. We don't want it to, we've been blessed in Montgomery County because so far there hasn't been any cases in any of our houses.
Yeah, we put on our website, on CCI website, there's a lot of good contact information, and we even put on our website how to make a face covering. And we actually have it in our waiting rooms now because of the new role from the governor saying that everybody needed that. So, not everybody can afford to get a mask. And we had to protect our staff and hold on to our resources. And so we couldn't give them out to everybody because we knew that would be the next request, that the staff, the patients would want us to start giving them our masks, so we had to give them another resource. So it's on our website, and now we have it on our TVs in our health centers on how to make a face covering or a mask. So we are continuously pushing out resources and links on how to just be creative in these times.
That's great. Thank you. And Cari, if you can start us off with a lot of people working from home for the first time, what are some, including us, what are some tips and strategies what are some tips and strategies you would suggest to help them manage this change in their daily routine, which can be anxiety inducing all in itself?
Yeah, I think we tried to start allowing people to work from home as soon as we could. It's a challenge because we do have essential workers in our residential program and our crisis houses who really can't work at home. They have to come into the office. So we try to find the balance. But for many people, the challenge has been that they have kids at home too now. I mean, I think that's been the biggest challenge, is trying to balance the work and taking care of your kids and making sure your kids can get online for their schooling and finding that balance. So a lot of things that we've done are things you've heard about. I'm sure people have heard about that, it's been all over the internet, but making a schedule for the day so that when your kids need to be online for school, so that you can help them with that and it doesn't conflict with what you might need to do for work. Making sure that you take regular breaks. I feel like I thought I sat at the office a lot in front of the computer, but at home I feel like I sit even more. So I have to make sure I get up and take breaks. And if I can't work in a day, then we tell staff, use leave. If it's not going to work, if you really need to just focus on your kids that day, then please use your leave, your sick leave, vacation, whatever, so that you can focus on what you need to get done, and then hopefully another day focus on work stuff. So really trying to help people do that. And for most of our people, we are able to also say, be flexible. If you need to be working with your kids in the morning on their school stuff, then don't start working for us until the afternoon. A lot of our admin staff, they can do their work any time of day. So if they end up working 12 to 8 instead of the usual 9 to 5, that's fine. We can be flexible. It doesn't matter to us as the work gets done. I don't care when it gets done. Even with our clinics, they're doing most of their services now, all telehealth, except for our injection clinics. We have people coming in for injections, but everything else is pretty much telehealth. And so I say, hey, if you've got clients who want to do telehealth in the evening, if you're open to that, it's fine with us. I mean, do it on the weekends, however you work your hours out, whatever works for you. And, making things as, less stressful is fine with us. So we truly try and push the flexibility, having some structure, and making sure people take breaks. That's what we focused on.
I agree. We have 11 employees from I'll say 12 employees from our offices in Silver Spring, and they're all teleworking. So we meet on a weekly basis to discuss what's going on, how's it going, and just really taking care of yourself, because you can get so consumed on the computer, like Cari said, that you forget to take care of yourself or stand up, take a break. Call someone to talk to. Don't get stuck on watching the news as much. I really want to stress that point because it's so offensive. So it's like, just, take some time for you too, while you're doing that work at home. It's just so important, because you can get really stuck on the negativity instead of sitting in some things that are really positive about just helping people in this process. So we're honored that we can meet every week and talk about what's happening, how we can help people more during the COVID-19.
Yeah, I agree with CCI. Most of the admin folks are working from home. All the clinical people, unfortunately, can't, because we do see patients. I would say that for people that are working at home, it's really important, as my colleagues said, try to have a routine, have a schedule. In my private practice, this is something, I do have a private practice, and I am not working from home. This is just a virtual background. That, talk to, if you are working from home and you have a spouse and you have children, talk with your spouse on how to have a schedule that one can be working while the other one might be helping the children, and really kind of share that responsibility, because I've heard that it got kind of chaotic from the very beginning. And so if you can establish that routine and that schedule between partners, so you're supporting the kids, then it gets a little bit better. I've heard that's worked really well. Try to absolutely 100%, I agree with Anna, to limit your media exposure to maybe twice a day, and make sure that it's a reliable source. I always say, make sure, don't believe everything that you read on the internet. Make sure it's from a reliable source, because it is increasing anxiety. We here at CCI, I'm sure Cari and Anna too, all of us were listening to the state stuff, the federal, we're trying to comb through it and see how it applies to our agency. But we have to do that because we have to know what's the latest policies that we have to do. We're a federally qualified health center, so we have to make sure that we're abiding by the federal regulations. So, and then take breaks. I think I sent a lot of resources to Courtney that I hope she'll push out to you all on mindfulness and chair exercises. And it's really important to get outside and get some air and fresh air and get that good vitamin D and be safe about it. But I'm literally hearing from people that are so afraid that they're not leaving their houses. You can leave your houses. It's, this is not a virus that's, floating in the air. It's something that is through droplets, and that's the exposure. So, do it smartly. I'm a big athlete. I walk, I don't run anymore. I write, Courtney, you do. But I have a bandana, and when I'm walking, if I come near folks and it's, we all go around each other, I'll pull it up. So it's really important that you have that balance, that the routine should not change. It's just adjusted to be safe at this point.
Yes.
I also have a bandana when I run. I just want to throw that out there. I'm being safe, and I hop off the path if needed to maintain distance. So that's
and when I ride my bike, I actually have a neck gaiter, and I just put it up.
Yeah, that's the most convenient, but mine is fleece. And so we're moving into weather where it's not going to work.
Yeah, I have a bunch of different weighted ones.
All right, thank you. Those are all really helpful tips. And for those who have been furloughed or laid off during this time, what are some coping strategies that are more specific to what they are going through that you would recommend?
Who do you want to answer that question?
Oh, sorry, I totally forgot. How about you, Robin?
So at CCI, we've actually allowed people, depending on their length of employee, to voluntarily furlough themselves. And we've had some furloughs and people that are laid off, and it's very sad and unfortunate based on workforce need. Obviously that does make folks eligible for unemployment, but good luck trying to get through that. There are a lot of volunteer opportunities. You can go through the Montgomery County Volunteer Network. I think it's a good opportunity to really make yourself useful in the community because there are so much need out there in the community. I would, I know people are very stressed out financially, and it's very hard not to get caught up in catastrophizing it. I think you are in a very large cohort of folks that are unemployed, but I can tell you that I know somebody that lost their job and they found a job within 3 weeks. So you might need to look outside your industry temporarily because, sometimes you just got to do what you need to do to pay the bills. So look creatively and kind of look outside the box of what you might have done before and know that it's a temporary situation. And get into meetup groups. I work with somebody here therapeutically, and she has found that very helpful, that she's found her profession. She's a coder, and she found a meetup group called Women That Codes. Who knew that even existed? And she found that to be very supportive.
Yeah, thank you, Robin. Well, me speaking on some of the houses, we've been blessed at the Oxford House World Service Office to be able to telecommute and things of that nature, but members of some of our houses are in the struggle when it comes to being laid off or not having a job in this climate. And again, thank you, Robin, because some can get unemployment and some can't, and we're just utilizing our media pages like Facebook and posting different sites that are hiring. I'm constantly always looking for resources on that. Who's hiring? Who can I, send today? Because a lot of people in the houses, we pay our equal expense share weekly. So again, those things that can bring upon that stress in this and uncertainty in this climate of our COVID. So constantly putting up things where because people are still hiring, and that is a good thing, that everything isn't shut down, and some places are hiring and they need help. So we're constantly posting jobs so that people can have them. And our house has been very generous with understanding that and being like, we understand it, and we're going to try to be here for you as much as we can and give those people support so that they don't go into isolation or a depression because of what's happening with COVID.
Yeah, I think we've been very lucky at Cornerstone Montgomery. We haven't had to do any furloughs or layoffs. We've talked about it. One of the things that I've really focused on is being as transparent as possible with the staff and communicating with them that we are thinking about it, we're talking about it, we're planning for it, just so it doesn't surprise anybody. And though that it's our last resort, that we don't want to have to do it, that we are tracking our cash flow, we're tracking our billing, making sure we can plan out when it might have to happen. Thankfully, I was able to tell them this week that for the rest of this fiscal year, we should be fine through June. We won't be doing any furloughs or layoffs. And we're looking at the budget for next year. That's obviously going to be a challenge with who knows what's going to be happening with the state budget and things that we were supposed to be getting that we probably won't. So we're going to have to figure that out. But I'm just trying to be as open as possible with our employees. With our clients who have been laid off or furloughed, we have quite an extensive employment program. So our staff are already out there helping people look for new jobs in this current market, which is obviously a little limited, but there are still opportunities out there, and still just supporting people through this process and offering that support. So it definitely is a big deal, something that we're trying to be, again, as transparent as possible with our employees, and then offering the support that we can to our clients who are now unemployed.
Yeah, I mean, I would like to add that, for CCI, it wasn't like a huge furlough or layoff. It was actually a restructuring. So it wasn't like a massive, it was just like a couple positions, but it was going to be a restructuring anyway. So it just was an opportunity that the organization took. So it wasn't a big significant. And then we did allow people to self-furlough. And we also, some people have taken the opportunity to use the federal FMLs which is not FMLA, but related to the COVID because they have to take care of their children or some other reasons. And some of the employees really needed to take a step back because they were being affected by it and their anxiety. And we gave them permission to do that. We said, look, if you can't be there, an asset, I called it the second contagion. We gave them permission, do what you need to do to take care of yourself at this time, and give yourself some time off, either take PTO, talk to HR, explore your options, because, this affects our employees. We're in healthcare. And so it does trigger. This is not something that anybody expected. And a lot of people had not thought that this is something they would have to deal with professionally, and it kind of got everybody to really consider, wow, I didn't think I'd have to do this in my job, behavioral health and medical. So I think that we've been very, very supportive of our staff. We actually have daily call in at 12:45 every day but Sunday, where the leaders give everybody operational updates, what's going on clinically, what's going on and then after that, people ask questions, and we're always kind of tweaking what we're doing, our business. It's a really good opportunity for staff to really participate in how we are doing our business and our workflow. And a lot of things that we're doing now has to do with staff suggestions, such as putting the videos on how to make masks in our health centers. That came from staff. So, and we get 50, 60, 70 participants a day from the staff. So it's really good.
Wonderful.
Thank you. And Robin, I'm actually going to direct my next question to you as well, since you mentioned this when we were talking earlier. And for employees who have access to an EAP, can you talk a little bit more about what that is and how best to utilize it?
Yeah, EAP is kind of tricky because I think that it's a benefit. That if your employer has it, and it's a mental health and behavioral health benefit. I'm actually let Cari talk about it too, because she's the leader of her company. But a lot of employees are not. They feel that it's a pipeline back to their employer, and so they may be reluctant to use it. So we encourage them to use EAP if they want, but we also give them a lot of resources that they can go through their insurance, and we give them a lot of resources like how to find a private therapist, or how to access other mental health and behavioral services locally. Some of them are not comfortable using EAP. EAP is more for it's traditionally used that if there's if a manager or supervisor thinks that there might be a problem, a work performance issue, and let's say if I have a staff person that may have a lot of anxiety or depression, or there's some behavior that I think might be related to their job, that they could be sent to EAP. So it sometimes has a negative feeling about it, that people are forced to go and they don't realize that they can actually voluntarily go. But I'll let Cari also chime in that, because I know this is probably more her area of expertise too.
Oh, well, I don't know about that. We do offer an EAP as well through our insurance. And I think we experience the same thing, that sometimes people are hesitant to use it because they're worried it's going to get back to us, which it doesn't. The content is certainly confidential, but we encourage that as well. And a lot of times EAPs offer that short-term counseling and linkages to resources that can help people through kind of a brief intervention, a brief crisis stage period. We also offer our own clinical staff to do debriefings and to process situations that come up. We have had some clients who have tested positive for COVID-19. We have a couple who have been on ventilators, and there has been some anxiety and fear. And we do have some of our therapists have offered to go and debrief and talk to staff, and some of the staff take advantage of that. We do that through a Zoom staff meeting, or it can be a one-on-one thing. So we try and offer that even in-house, which I think sometimes the familiarity is helpful. They know that that person understands what's going on, possibly even knows the client, and that can be very supportive. So we definitely try and offer that as well. And then we have some external resources that we share with people too. So I think it's really just encouraging that self-care and making sure that people are taking care of themselves, however that works best for them. Is it best for them to talk to family or friends? Is it best for them to talk to their supervisor, the EAP, one of our internal therapists or support options? We really just want people to figure out what they need, and then we'll try and help them access that as much as we can.
Yeah, I mean, we do that also. I personally have gone to all the sites and have sometimes just sat in an office and said, I am here for the employees if you want to come and talk to me. And sometimes the manager has said, you should probably go speak to Robin. And I've had a line at the door. And sometimes I've been sent to one of our locations because they said, oh, you need to go there because they're like ready to implode and nobody wants to come and talk to me. So it really depends. But I think more are present and visible at your site's location. I think it lets them, the staff, know that we're all in this together and you are there to support them, and I'm ready to go back out and do that again. Not to really do any therapy, I call it like EAP light, just to give them resources and let them know what the services are for them. And then we also let them know that the behavioral health staff is available to them if they want to just come in and say, look, I'm dealing with this, what type of services or resources are available. Because we've had actually some staff that have said that they've been suicidal, depressed, have had some anxiety that had nothing to do with work, more personal issues. So we really want to be supportive of them. That, and that's not, and that has been shared privately with another staff person or manager.
Yeah, and I add to that, at Oxford House, we have an open door policy. So if you're feeling anything of that, you can always come to Kathleen Gibson, who is our chief operating officer. But I'm not sure about the EPA part because we're more of recovery based. But I'm sure that's just wonderful because people need that and need to know that it's there for them. If they need help, because this is a time that those things are going to pop up, like suicide and depression. Yes.
And I would say for the people that are here on the call, CCI is is available to you all, but the point is that you have to establish primary care. So it's that's the only kicker. We're not an outpatient mental health provider like Cornerstone is. You have to be a patient in primary care, which we have, go on our website, we have dental, we have everything, family planning, but we are also a mental health provider. That's the only difference between CCI and an outpatient mental health provider.
Thank you. Good information.
Yeah, thanks so much. And we've spoken a little bit about this question. We talked a little bit about parents working from home and juggling those responsibilities when their children are at home. How can parents best support their children during this uncertain time? Okay, Anna.
I'll just share a little bit about, because we do have women in children's houses, and we have employees who are now home with their children. Some of them are home from college and just out and working that. So that is a shuffle. And as my colleague spoke earlier, they gave some excellent examples of how to make sure you're taking care of yourself and also taking care of your family. So we're connecting with, working as a team in the houses that do have children, where the other ladies are able to show some love to during that time while they're there. We just did a newsletter featuring one of the, because she's a newcomer and she came from drug court with her newborn baby. So it's early in recovery and truly facing being there with the baby. So the house has embraced that, and they're just doing dinners together. When she needs to work on her recovery, they're watching the child for her. So it's a lot of connection with that. I think it's a growth time when it comes to that, but you do have to, as Robin and Cari said, set a schedule to make sure you're taking care of yourself too. And then focusing on work, but not constantly being at the computer all day. So yeah, it's a good thing when you have that opportunity to connect in that way. And we're taking advantage of that in Oxford House.
I sent Courtney, I don't know if you got it right before the meeting, 2 workbooks. One is for adults and one is for children on the COVID, which are really, really nice. I think with with kids, you know, it's kind of funny because I think what it was like last year or something, somebody was doing, I guess it was a Zoom, something from their house in the UK, and the kid came running in, and the wife went after it, and now it just seems to be kind of normal, you know, that children are going to be part of it, and people are embracing it, and I think it's fine. I know that the issue right now is coming up with how to help my children with school. I know with my own employees that's coming up where one of my clinicians was getting daily crying calls from her daughter, not understanding how to do the online schooling because her mother did not understand how to help her daughter. And so finally, we worked it out that she was able to take some of that FML that is permissible, and she's taken one day off a week just to be home with her daughter to help her with the school, you know, just to support her and her family and to reduce the stress. Because it's so much, it's easier and less stressful for her to take the day off than for her to get the crying calls throughout the day from her daughter, not understanding how to do the school. And that's actually a really good volunteer opportunity for these tutors. I think there's a lot of parents in this situation that would love to have somebody help their kid do their schoolwork. The high school kids or adults, you know, that may, you know, not be working. If they, you know, I don't know who's doing it. I'm just throwing it out. I know we have a doctor who has a high school child that speaks Spanish, and we're going to maybe hook them up with other employees just to help the children with their schools so their parents can actually work.
That's wonderful.
Sorry, just pulling up the next question. My apologies. Cari, we have talked a little bit about telehealth, which is obviously experiencing a lot of growth right now. And what are some advantages and challenges that you've seen or heard about from your colleagues with regard to telehealth or video calls, that sort of thing?
Yeah, definitely. I think we've been very happy with the changes that the state made, you know, to reduce the regulations and loosen things. That's definitely helped us out. However, there are many barriers to telehealth, particularly for our clients. We're working with people in the public behavioral health system. So these are folks who are Medicaid eligible, low income. Many of them do not have smartphones. Many of them do not have regular access to the internet. Many of them have very limited minutes available on their flip phones that they have. And so it's been a huge challenge to engage them in that way, at least with the video telehealth. We can use in a limited way the phone now, which is huge. That's definitely made a difference. But even then, that impacts minutes. So many of our clients have very limited minutes on their plans. So they run out of minutes well before the month is out now that they're talking on the phone so much more. And when we do get people access to things, they struggle with using the apps or the websites or the platforms. For those that are connected, we found that most of our issues have nothing to do with the platform themselves. It's often user challenges, user errors. And that's, I'll be honest, for staff as well as for clients. You know, we do have some staff who struggle with technology. So I think it's definitely been a challenge. A lot of education. We have an IT department, we have staff in IT, and they are definitely on call and reaching out and trying to help resolve issues all day, every day right now, more so than they usually are. A lot of our staff are actually coming into the office to do the telehealth because they feel more comfortable doing it with the equipment we have on site, and then they can reach out to the clients at their homes. But still that issue with the barriers that clients have. And there are resources out there. I mean, we certainly have talked to the clients about resources to get better phones, to get more minutes, to get free service, but it's a challenge to access those, and they're limited. So that's, you know, it's just an ongoing struggle that we're still trying to deal with. As for advantages, I think one thing that we've really found that has happened is we do have clients and staff who really love using telehealth. They really like it. We have some clients who are like, I want to do this forever. You know, they really like it. They can use it successfully. And it really has allowed our providers to see a new side of our clients. You know, they're getting to see their pets. They're getting to meet the rest of their family members, maybe, you know, in a different way. They get to see their house, you know, what their house looks like. And I think it's really added to the relationship. I mean, they're going to have a different understanding of the client, a better, kind of understanding the client's worldview and their perspective in a totally different way that I think is really going to be beneficial in the long term, even in the short term. I do think are people who are going to want to continue doing telehealth after this is all over. And, we'll see how restrictive they get with the requirements again and the regulations. Hopefully they'll still stay loosened to some extent, because I do think there's a benefit to that. But I do think that some people will continue to do telehealth when they can, and I'm totally in support of that. But there definitely are barriers that we still need to figure out how to overcome. We are looking at options. We're applying for a grant right now where we're going to get asked for funding to help buy more minutes for clients, or even smartphones, or MiFis or something, where we can provide support for up to a year of service so that they can continue to have this, because we see it as such a need. But finding those resources is a challenge for sure.
Thank you, Kara. That points of where we are with our members of the houses, because again, low budget, just getting their lives back on track. So, and then some of the houses don't have up-to-date computers, so there's no webcam to do the Zoom or to connect on something that's required, a weekly house meeting. We have to do those. So we're thinking out of the box. Our outreach team, resource team, we're calling, trying to say, okay, let's work with someone's phone who's up to date so that we can get this done. If it's a new member of the house who really needs to just sit at a virtual meeting, let's share with each other. It's bringing connection on that with most of our houses, but the struggle is real with that for the virtual part. So we're getting better at it. It's a lot of teaching. But there are different trainings out there that are helping people in different ways and stepping up in that sense. So we're offering those resources.
Yeah, time helps too. It's definitely gotten better since we started.
Yeah, 100%. I agree with everything that Cari said. I think for us, this whole thing caught us off guard because we did not have telehealth as a service. And we realized that our electronic medical record has an option that we hadn't turned on. So we, quickly said, oh, we want it. And they were like, get in line. So then we said, okay, what's plan B? So of course, everybody tried to do Zoom. Well, Zoom is not designed for telehealth, and, Zoom got completely overloaded. So one of our doctors said, try Doxy.me. So we went over to Doxy.me. I have a Zoom account, and Doxy.me was really nice because it's actually like a real clinic where they have waiting rooms. And we liked it so much that our psychiatrist, who also had a private practice, said, I'm going to move over to that. And it's a big learning curve. And I do agree with Cari saying it was really nice at the state, as opposed to some of the other states, because I do have colleagues in other states have been very generous in how they have allowed us to really bill for it and get reimbursed, even for telephonic sessions, although we try to keep those short. I do think it will, it's another option, I think, for the future. Just accessibility, people that have transportation issues. I mean, it's a really good option for the future. And right now, and it's, user issues, same thing, connection issues, same thing. One of the things that came up recently is, when we do face-to-face, I'm wearing a mask, my patient's wearing a mask. And in behavioral health, I kind of like looking at the nonverbal cues. I want to see their expressions. I can see their eyes, but I can't tell if, somebody says they're okay, but they're actually frowning and crying and they're stressed and they have anxiety. So one of my staff said to me, well, Robin, why can't they come in and they be in a room and I be in a room and I can see them through a telehealth? And so I actually asked my expert with insurance and billing, I said, what would that be billed as, a face-to-face or is that telehealth? She said, no, it would be face-to-face, because I actually did that with my own primary care provider. So we're kind of exploring that, that would take up another room, but is that a possible option that we could actually be in, 2 rooms next to each other and do a session that way? Because you do lose that personal touch when I'm in face-to-face and everybody's wearing masks. and gloves, and everybody's wrapped up, and I can't see that expression. So I think it has its pluses and it has its minuses, but it's a really good option. The other issue that comes up for us is that CCI is the second of two FQHCs, which are federally qualified health centers that see a very large refugee population in the state of Maryland. So we do, for the downstate area, there's one up in Baltimore, we do all their health screenings that are coming in. So we have to use translation services, and CCI, 60% of our populations are Hispanic, and we have bilingual staff. And sometimes we have to use translation services. And so we're trying to figure out how to get the translators into the telehealth system where actually people can hear each other. Is it through a desk phone, or we're conferencing in? So we are looking at what's the best practice for that. And then the last thing is obviously confidentiality. Some of the patients, our clients, don't want their family members to know that they're having a counseling session. We have seen an increase of domestic violence that's going on right now, just nationally, and child abuse. And so some of our patients don't want to have those sessions in their homes. So they're literally going into their cars, or they're walking down the street. So we got to make sure that it's a confidential location and they're feeling safe. So I just wanted to throw that out, that that could be an issue too. They're literally in their cars having their sessions.
I think we found that it's been really helpful, even for our case management and vocational staff, that they are able to do telehealth and make phone calls and just check in on people, because that was a concern we had. We wanted to limit, obviously, the contact, the social distancing, keep people safe. However, with the changes that the state made, all of our staff can use the telehealth and can reach out via phone to check in with clients to make sure they're okay. And the clients have told me specifically, that they really appreciate that they're really glad. They understand they're not going to see people as often face to face, but that staff are available. Everyone will come into the office if they need to see staff or need to see clients. They will go into the community, all of the staff that we have in place already, our case management staff. However, having that option has really made a big difference and has made a lot of our clients feel much more secure and confident that they aren't going to be alone, that they're going to be able to continue to get the support through this whole pandemic. So that's been huge.
I just want to some of the avenues that we're using for people who are suffering from mental health or in recovery. So we've been able to do, because it is important to see the face and really connect in that way. I think that's so important. So we've been able to do Zoom in the rooms. It's a global recovery community. Go to meetings. We've also been able to use Google Handouts and Skype to make that process happen. There's so many avenues that we can do now in the COVID climate, is what I'm calling it, to really help people connect when it comes to, I know treatment centers are also doing that in Montgomery County. They're, getting the group together and doing the virtual meetings in the room so that people can stay connected to the recovery process and not get overwhelmed with fear.
Yeah, I mean, they're doing virtual AA meetings.
Yeah.
I get all the, and I'm sure you all do, the updates to the state of Maryland and through Optimum, which is the Medicaid pass through for Maryland. And I see all these really good regulations for substance abuse and supportive employment. I'm like, well, it's not CCI, but this is all really good stuff. It's kind of funny. As we're talking about this, somebody just texted me, it came through my watch, who's providing telehealth mental health for DC right now? I need a resource. And I just quickly texted her back. I said, everybody should be offering that right now. So it's people are looking for this resource all the time. And if they aren't offering, they are so behind it. It's shame on them.
Yeah, that's right.
Thank you. And before I jump into our next question, if anyone has questions they'd like to ask, please feel free to chat them directly to me now. That way we'll be all prepared for our formal wrap-up question. Anna, as we look forward, as to how the situation evolves and after, what are some valuable lessons we can carry from this experience, do you think?
I really want us to be not living in fear, but just letting this be a learning process, a connection process, to communicate better, teaching us different ways to really reflect on ourselves. I think I'm seeing a lot of that happen within the recovery community. I'm a woman in long-term recovery, 20 years clean. I lived in an Oxford house for 2 years, and honored to be working in the field, and just hearing a lot of gratefulness, and just really, it makes you step out and do things that you never thought you'd see yourself doing. So we're just keeping an eye on that, and doing that more. And within our houses, we're just, the importance of really listening and staying healthy and staying safe. Is really what I'm feeling is totally needed. So be patient, kind, and thoughtful to each other. Seeing a lot of that happening and wanting that to happen more in this process of COVID.
Yeah, I agree. I mean, I think trying to keep the positive attitude and the patience is really important. I think looking forward, lessons to learn is obviously I need to keep more toilet paper on hand than I have in the past. But even more than that, I think what we found we've mentioned it a little bit, the PPE issues and trying to have enough PPE on hand for emergencies. Not that I want to be a hoarder and have more than we need, but obviously we need to have more of those things on hand down the road, because this is going to happen again, I believe. And, I think we will be more prepared in that sense. And then I mentioned earlier, maintaining the technology for telehealth. I mean, I think continuing to use it, but being able, we already were using telehealth, but nowhere near to the extent that we are now. So being able to ramp up again to do that when needed, I think is something we want to make sure that we keep preparing for. And, particularly I think staff at our clinics, because that's where telehealth would mostly be used in typical times, making sure that all of those staff know how to use it and even are using it with current clients. Not with everybody, because definitely face-to-face, I think most people prefer that when it comes to behavioral health issues in particular. But making sure that we still have the technology and people understand how to use it. Again, just kind of being prepared. We have to have all those crisis plans in place, and we've always had them for, hurricanes and blizzards and, unfortunately, shooters on site and things like that. And I don't know that we've ever had a very detailed pandemic crisis plan, but we do now. And we will definitely that'll be something we maintain and review on a regular basis.
Yeah, I really like what you said, Cari. I would say this was, I'm taking this from one of the many webinars. This was one I was on last night. It said to practice radical acceptance. And not scapegoat. I think it's really easy just to start blaming and pointing fingers. I think that this started in the very beginning when staff was like, "Oh, you're trying to kill me and you're putting me at risk," and that's what breeds the anxiety in people starting to where you have companies and small businesses start to implode. But if you just say, okay, it is what it is. We have to. That's what radical acceptance is. And then start thinking about how can I help to improve the current situation that we're at. We've learned through this experience, because we had to, right? It just caught everybody off guard, how to improve our current situation, our current business practices, our current workflows. And now I think we're gonna start putting things into place as actual regular business practices. And then after everything is sort of solidified, then I think staff and employees need to think about, really have a really good personal inward thinking about, is this where they want to work? Because for me as a director, I think staff are going to have to give it a hard think, because I can't guarantee it's not going to happen again. So do I want people running around like they're, like the world's going to end? It may not be the place for them to work in the future. Maybe they need to take, maybe they need to go into private practice. Or so I think people are going to have to really give it a hard think, because this may be an annual thing. It may not be as catastrophic as it is. Let's hope not. But I think people are going to have to really give it a hard think after this comes down a little bit, about the places that they're working and the risks that they are going to face. And is this for them? And maybe, take stock and maybe make some career choices instead of, as I said, making it the second contagion. And I'm going to have to, as a director, have some conversations with some of my staff about it too.
I think that's interesting. And we actually have had the same conversation. During this pandemic, we've had 2 staff leave because of it. Just 2, which I think is not that bad.
That's amazing.
But we have amazing staff. I'm sure both of you would say the same thing, who just stepped up and are there for the clients and are doing everything they need to do, even though we're all afraid, especially the ones who are working in the 24-hour residential, where they could potentially be exposed to people very directly. What's that going to do for their, bringing it home to their families? I can't even begin to express the gratitude I feel and appreciation for the staff that we have in those situations. And though I do fully expect that once this is all over, whenever that's going to be, that is when we will have people taking on an assessment of, is this really where I want to be? Is this what I signed up for? And I do wonder if we're going to have people leaving then. Like they'll get us through the crisis, but then they're going to be kind of reevaluating. And I completely understand that. I hope that I'm wrong. I hope that it doesn't happen that way. But we've talked about it. HR certainly talked about it, and something that we're going to have to be prepared for potentially. And I completely understand. I hope I'm wrong, but it's certainly something that we've talked about.
And I think as employers and hiring managers and folks, I think we need to allow that and say that that's okay. And it's better to allow folks to step aside. And I said in the very beginning, be an asset, be all in, or just take a knee for this and give permission to do that. And because, you go into survival mode I did, there was another webinar I listened to on learned helplessness, and that's what happened. I don't know if you've noticed this in some of your businesses, that all these great employees that were able to make all these great independent decisions and be self-sufficient, all of a sudden lost those talents and those abilities. They just all of a sudden became very dependent on us as leaders and mommy and daddies. They couldn't make, they're like, now they wanted us for guidance because of the anxiety and the stress and the fears. It's like, what happened to our workforce? Now they're not these independent, autonomous, strong people. And that's what happens. You just go into those basic instincts and get into this survival mode, and it's called learned helplessness. And so, we have to empower them back up again and to let them know that, that you have that. Just let's get you back up and get you back up into that skill set that you had before.
Yeah, thank you all. I do have a couple of questions. So I will throw those out there, and whoever wants to jump in first, please feel free. So for those that may be exposed to COVID-19 positive people through their clients, what processes are they going through when they come home to their families?
Well, we follow what the CDC and all the regulations require. If we think someone's been exposed, or we did have a couple clients in our residential who have tested positive, for those staff, they immediately went into quarantine at home. We provide them with masks that they can take home and use for themselves and their family members. Obviously, they need to isolate from their families for the 2 weeks or while they're being tested for the virus. Thankfully, so far, all our staff have tested negative. So they don't come to work until they test negative, or we know for 2 weeks they don't have symptoms, or if they have symptoms, then they have to be 72 hours fever-free without medications before they can return to work. So that's what we do in terms of work. In terms of at the office, if we know someone has tested positive, a client, Then we immediately step up. I mean, people wear the more elevated PPE. We're very lucky. We have the N95 masks at this point for all of our staff who need them, gloves, gowns, all of that kind of thing. If someone is sick and we have to maintain them in their home, then we might be going in to help them. You know, we bring them food, make sure that they're taking care of themselves, make sure they're taking their temperatures every day. So we would be in the houses, especially the 24-hour houses. Staff are there 24 hours a day. So we just make sure that we're following the PPE. We do ask the clients to stay in their bedrooms at that point. If they are sick, we will isolate them. We'll put them in their own bedroom and make sure they have their own bathroom, which might require moving some people around, which is never the top choice, but we obviously need to do this in this situation to keep people safe, to keep the rest of the clients in the house safe. We'd already been doing, making sure that all of the houses had sanitizing wipes and that they were doing regular sanitizing of the doorknobs and all the, you know, shared areas, the common areas. That had already been happening. At this point, we only have 2 of our residential clients who've been sick. We do have others who are not in our residential program who have developed the virus. About half of them have been able to maintain at home, and the other half have been at the hospital. So it really is just about making sure that we have the PPE in place and that people have access to it as soon as possible, and making sure they know, don't worry about coming back to the office. We've got things covered. You go home, you take care of what you need to do at home with your family, and let us know what supports you need. We have talked about, you know, do we have any place that staff could go if they don't want to go home to their family? Right now, we don't. I mean, we've got space in, I guess, some of our administrative buildings, but there's no showers there. There's nothing there that we could have where people could really live somewhere. One of our residential crisis houses, if intakes drop and we don't have a full house, we potentially could, you know, condense and close one house temporarily and use that house for staff. We've talked about it. It hasn't come up yet as an option, and we haven't really had the need yet, but certainly that is something that we've looked at in terms of alternatives and other things that we could provide. We don't have the funds to provide people with money for hotels. I wish we did. I would love to be able to offer that, but that's not something that we are able to do in our financial situation right now. But certainly these are all the kind of options and the brainstorming that we're doing to try and figure out what could work and what could help the staff.
That's a really good overview. We have not had any staff that have gotten symptomatic from patients. It's usually been outside contact. And you know, we do heavily screening, like I said, for anybody that's coming in before they even come into any of our health centers. We have staff with full PPE and a thermometer. They do all the screening tests before they even enter the health center. So we try to catch them before they go in. And then we have isolation rooms in our health center, and that could be for flu or whatever. So we try to be as safe as possible. If somebody has symptoms, they follow the same standard guidelines that Cari said. And right now we just want to make sure that we're not bringing them back sooner. So we've had some people that came back, became symptomatic again, and then we had them go back home. So we want to make sure that we are not bringing them back sooner, and that they are 100%. You know, this is also the allergy season. We're not done with the flu also, you know, so, you know, I had that was one of the reasons why I had one of my staff go out on to start telework, one of my first staff, because she, you know, she was having seasonal allergies, and she has, you know, she has bronchial stuff, and she, you know, she was coughing, and she was with the inhaler, and she was in a shared workspace, and, you know, her coworkers were getting a little wigged out, and even though it was completely explainable, it was making her colleagues a little nervous. So I said, you know what? You've earned the right to work at home. So just to, you know, you got to do whatever you can to make people less stressed out. So she was able to be the first one to go work at home. I had another employee who is in a multi-generational familiar home. She had a sister-in-law that works in a skilled nursing facility who had some symptoms where she had a reoccurring fever, had tested negative for flu A and B. So the sister was sent home to be on self-quarantine. And because she lived in that house, I said, you have to be working at home too. So we just are so erring on the side of caution. And because she was administrative, she was able to telework too. So we're just being super, super cautious and making sure that everybody has we're always masked. Anytime at CCI, the only time that we're not masked is if we're in our private offices. So we're walking around. I have a N95, really pretty orange mask I can show you when I'm meeting with patients. But anytime there's any contact, human contact, even in our boardroom meeting, we're all masked up. And we're sanitizing our offices 4 times a day. And that's employee volunteer. So we're wearing masks, gloves, we sanitize our offices, and that's in addition to our cleaning crew. So we're trying to be as safe as possible. And if there's anybody in our isolation room or somebody that comes in sick, then the room is sanitized and left for 3 hours. That's the CDC standard.
Great, thank you so much. More question. Do you think that there will be some unique anxieties that develop from this time period, such as more aversion to gathering in crowds, to touching people, like shaking hands, that sort of thing, or say PTSD for people who are on the front line, health workers, or people who've recovered from this illness?
Oh, 100%. I mean, we use cognitive behavioral therapy at CCI, and I absolutely think that that's going to come. I thought about that myself. This has been really hard for extroverts. Introverts are like, hey, this is easy as heck. You know, I love to keep it to myself, no problem. But extroverts like me having a huge issue. So I'm a big social person. I love concerts. I love festivals. I was just talking to a friend of mine. You know, I have concert tickets in September. I'm like, So we're all kind of thinking about that. I think, you know, it's going to change everybody's perspective on how we view social gatherings, you know, in large places, because DC, the DMV, who doesn't like a good street festival? Who doesn't like, you know, a good, you know, Adams Morgan Day or, you know, whatever, you know? So I think it's going to drum up a lot of stuff. And I think, you know, one thing good about CBT, it is really short-term targeted goal that we work on. And, you know, and we work on good strategies and coping mechanisms. So I definitely think the piece about, like, do I need a therapist? Do I need to go to counseling? If it's present for a long period of time, that it's actually affecting what you would consider your normal baseline functioning, it's probably a good time to engage with somebody. You know yourself, or somebody says, you know, you're not yourself. You know, that's a good way of sort of gauging whether you think it's time to maybe engage with somebody. Oh, by the way, this is my fancy N95 mask that I wear.
Very bright color.
I had to put my name on it because, honestly, somebody stole one out of my office. That's how you have to protect your gear. Yes. Yeah. We've had boxes of masks stolen from our health centers. We have to lock this stuff. This stuff is precious cargo. Cari, have you had any equipment gone missing?
We haven't really. We thought we did, but it just turned out that the bags that had been delivered were shoved in a closet. So we found everything. So far, so good. We've been very lucky. We've got a lot of great donations. I even have my mother making us homemade masks. So we've got a lot of great donations, and we've been able to access some stuff through the state. And then, of course, we are spending a lot more of our own money on this thing than we normally would have, but it's been worth it. And right now, the biggest thing we're having trouble with is thermometers. We've got masks. We're having a hard time finding thermometers. So that's our challenge right now.
I just want to let everybody know that it's recommended, I don't know if you can see that you store your mask in a paper bag. Don't throw it in the backseat of your car. Don't put it in a Ziploc baggie or a plastic bag. The paper bag is supposed to help it breathe and dry out. Because remember, they're so hard to get that we have to let them last a little bit longer. So that's what the CDC is recommending if you want to let your mask breathe and store out a little bit. You want to let it, remember it's the droplets and the moisture, so you want to let it dry out. Because I actually talked to a friend of mine. I said, "Where do you store your mask?" She's like, "I just throw it in the back of my car." I'm like, "Oh my God." I said, "Are you kidding me?" I said, "Could you at least hang it from your rearview mirror, let it dry out a little bit?" So store it in a paper bag.
For at least 3 days. The CDC says it should be stored for 3 days. Takes 72 hours for the virus to die on one of those things.
Yeah.
So you really need enough masks, and so that you can have it, you can rotate. That's what we've been getting to our staff, but it took time for that to happen. But
yeah,
I'm happy to hear you all have masks. It's something that we're struggling with in the recovery houses in Montgomery County. So I'm going to put it out there. If anyone knows where we can get PPEs at, to please let Courtney know so that she can let me know. Because
reach out to the,
you all have it.
County, Anna, reach out to the LBHA. Reach out to them.
The LBHA? Okay.
Yes.
And the Montgomery County Volunteer Corps, they are the Emergency Response Corps. They're collecting a lot of these from local volunteer businesses and stuff like that are donating it through Montgomery County. So they are collecting it, and I don't know how you get on the distribution list, but if you look at the Emergency Response Corps, they're collecting it, and then I would call Montgomery County and figure out how they're distributing it.
Okay, because we've been blessed to have no cases, but we want to be prepared, and we are trying to make the socks that they're doing. But yeah, if it's a place that we know of that has PPEs for the recovery homes in Montgomery.
Yeah, I would call Montgomery County and ask them, and see if you can get on the distribution list through the Emergency Response Corps.
Okay, wonderful resource. Thank you both on that.
That is something we love to see, our members sharing resources. So thank you so much to Robin, Cari, and Anna for joining us on our panel today. And thank you to everyone for attending. We will send out those materials that we've mentioned as a resource for you, and as well as copy or a link to the audio recording of this event, and that'll be available on our website. We have our resource page on our website for businesses that are operating at this time, as well as our information page about what's going on federal, state, and local. And you can always send us any news items you have that we can feature in our newsletter. All right. Thanks so much for coming. Have a good day.
Thank you,
everybody.
All right, have a good one. Good seeing y'all again.
I had to remove a few people by hand. I think they sort of walked off and abandoned their computer.
Yeah. Can you stop